Assalamu alaikum wa rahmatullahi wa barakatuh. Peace, mercy, and blessings of God be upon you. This is another presentation from www.central-mosque.com and from the Humble Heart YouTube channel about the coronavirus Ramadan policy and a comparison between the recommendations of Mufti Taqi Usmani and the Haramain. As usual, we'll do this in a systematic and organized manner and sequentially. Let's begin. Before we begin, first of all, we need to understand the difference that Pakistan has to the West. The demographics, the lifestyle, the people are entirely different. Mosques play a very important role in the life of Muslims in Pakistan. The Imams play a very important role in the lives of the people in Pakistan. You all need to understand that basically mosques are needed to educate people on coronavirus, provide aid, look after the welfare of the people. And this is what Mufti Taqi Usmani, Hafidhahullah Ta'ala, has specifically alluded to. Contrast the situation in Pakistan to India, where I've seen people, videos of children eating frogs and things are really bad, riots, and so on and so forth. So the mosques can and do play a vital role within the community. This shouldn't be compared to the West because the situation is vastly different. People are different, mosques are different, demographics are different, and so on. So, in the press conference on the 14th of April 2020, Mufti Taqi Usmani Hafidhahullah Ta'ala made some recommendations. There was a lot of criticism for people on social media that he's trying to set up a parallel government or he's trying to undermine the PTI government of Imran Khan, but he merely made some recommendations for the government to ultimately decide on the 18th of April 2020. His recommendations, as he stated, were based on sound medical and technical advice of doctors. Now, you can disagree with his opinion, but you cannot medically refute his advice. He recommended the people under 50 should refrain from coming to the mosque, social distancing should be followed, hand sanitizer should be installed, carpets should be removed from the mosques, and the rows in the mosque should be appropriately basically distant. One row should be skipped, and so on and so forth. And importantly, people outside of Ramadan, as when he said this was outside of Ramadan, should only come to the mosques for obligatory prayers only. Now, coincidentally, I happened to speak to a doctor in Pakistan who advises WHO, and they shared some of their recommendations. So it became dead clear to me that Mufti Taqi Usmani Hafidhahullah Ta'ala had sound medical advice on the issue. So first of all, he's not just going to speak out of his back pocket anyway, but that kind of a lot of people might not have the kind of context. So this, I had first-hand experience, so I know that basically he has taken advice from doctors because what I saw in the recommendations are pretty much what he was saying anyway. The criticism towards Mufti Taqi Usmani Hafizahullah Ta'ala on the social media was from the usual secular liberal quarters, usual news anchors, usual politicians, usual TV channels. Our sincere brothers and sisters in the West who don't know the situation in Pakistan, perhaps do not follow the media regularly, they basically reproduce this criticism without knowing where it comes from. Now, these are the kind of people that will attack Islam and they will attack the scholars no matter what. Okay, they will find something to attack because that's the way they are. These TV channels, these news anchors, are certain people. If the criticism is with good intention, is on good grounds, excellent. I'm all for it. However, these are the kind of people that simply say things, and they say this all the time. Now, the very next day, WHO issued its guidance for Ramadan, and it's worth noting that they have not banned anyone from the mosque. That's point number one. Secondly, their recommendations are pretty much what Mufti Taqi Usmani Hafizahullah Ta'ala had said in his press conference the day before. So, you can read this yourself. There's a link in the description. So feel free to analyze it yourself. I'm not gonna, take the time to talk about this because it's all there in black and white. The upshot is that the Taraweeh is not banned, but access to mosques needs to be regulated and managed. On the 18th of April 2020, the President of Pakistan outlined the government policy in 20 points. And it is very similar to what Mufti Taqi Usmani Hafidhahullah Ta'ala had suggested. And I keep saying suggested because there was a lot of confusion amongst people, and all he did was made suggestions. The same news anchors, the same politicians, the same TV channels started abusing the government in Pakistan. They've capitulated and surrendered to the mullahs. Nothing like that, because when you read the detailed WHO guidelines, it's very similar to what all of these sources are saying. You got to understand the situation in Pakistan. People were coming to the mosques anyways, so these policy guidelines were necessary, and they have been given to regulate and manage access and avoid the spread of infection, and not the other way around. The media has been spreading pictures of overcrowded mosques, and these are bad examples of attending mosques. As a result of policy guidelines, the mosques actually look like this. So what you see in the left hand side is an example of Maghrib Salah from Darul Uloom Karachi, where Mufti Taqi Usmani Hafidhahullah Ta'ala teaches. On the right is another mosque from Karachi. Now, Karachi is one of the largest cities in the world, so you might think that basically this is happening in large cities. Not the case. Since the recommendations of Mufti Taqi Usmani, this is an example from a mosque in, this is a picture from Bannu, KPK, a town, and I wanted to show you that these preparations are being made all over Pakistan to enforce WHO guidelines. Simply because you have to understand that a lot of people in Pakistan don't have access to WHO guidelines or the media. They are simply doing it because Shaykhul Islam Mufti Taqi Usmani Hafizahullah Ta'ala has made it very clear, and the scholars in Pakistan are making it very clear. Another point I wanted to point out is not Mufti Taqi Usmani, but other scholars have saying that look, there's a lot of conspiracy theories that this virus is man-made, etc. So they wanted to cut down through this clatter of fake news and put solid recommendations what can be followed. Last week there were some pictures, changing topics for a second. Last week there were some pictures of Westminster Bridge in London where social distancing was not being followed. Now these are COVIDiots, people who are not following social guidelines. They're not really very good examples. So if the media, whether it's Muslim or non-Muslim, is showing pictures of mosques which are overcrowded and people are not following social distances, that is not what Mufti Taqi Usmani Hafizahullah Ta'ala has suggested at all. These are the examples of what he suggested. So once again, you can disagree with someone, but you cannot say that this is not this does not conform to WHO guidelines. Again, the link is in the description. Now, many of these, our brothers and sisters, are critiquing Mufti Taqi Usmani, Hafidhahullah Ta'ala, as to why he's allowing Taraweeh when Taraweeh is Sunnah and it's not obligatory. In the Hanafi madhab, the establishment of Taraweeh is Sunnah Mu'akkida, meaning it's an emphasized Sunnah and not just Sunnah. So in the life of Pakistan is the 7th largest populated country in the world. And in the life of the people, Taraweeh plays a very important role in Ramadan. Now, I know that, I have had the fortune to live in the Arab countries and stuff, and they have a completely different attitude to Ramadan that we do in Pakistan. So it should be appreciated what Shaykhul Islam Mufti Taqi Usmani Hafizullah Ta'ala has done. It is tried to regulate it, formulate it, and to guide people. Since then, 20th of April, the policy of the Haramain came out about Taraweeh. So once again, Haramain is also not banned Taraweeh. What they said, the Quran will be finished on the 29th of Ramadan, as usually they do, but they've reduced the rakat units of Taraweeh from 20 to 10. Now, I find that, those people who were criticizing Mufti Taqi Usmani, Hafidhahullah Ta'ala, that he is allowing Taraweeh when Taraweeh is Sunnah, all of a sudden they've fizzled out. They have got nothing to say because Haram has done exactly the same thing. They've allowed Taraweeh, not for public, but in some capacity. They will be reading the same amount of the Quran, but reading it in 10 rakats instead of 20. In my opinion, and from little what I know and from what I've read, the WHO guidelines, there's no medical reason for that. If you're going to read a certain amount of the Quran and is the same amount of the Quran, then doing it in 20 allows you for a little bit more flexibility, breakdown of rakat, and gives people a break and so on and so forth. But it is what it is. What I wanted to point out here is the criticism towards Mufti Taqi Usmani Hafidhahullah Ta'ala from certain brothers and sisters in the West is completely, you can disagree with an opinion on fiqh, but you cannot say that this opinion goes against medical advice, because it absolutely does not. Now, there's a possibility that some mosques might become hotspots for coronavirus, and may Allah Ta'ala protect us if that happens. my dua, my prayer is for everyone to be kept safe. But the government is saying if that happens, then we'll roll back and we'll act accordingly. Now, contrast it to many countries in the West, which are now opening up, after severe lockdowns and restrictions, and they're all saying the same thing. Look, we're opening up, and if something happens, then we will react. So there's no point in criticizing Pakistan or Shaykhul Islam Mufti Taqi Usmani, Hafizahullah Ta'ala, for that, because they're going to do the same thing. If they are, and I hope not, unfortunate consequences, or somewhere a certain mosque or community becomes the hotspot, then this is going to be managed, and this is going to be very similar to what is happening elsewhere in the world. Now, as I might have said it, but I wanted to point this out again. This is a discussion about the situation in Pakistan, and Haramain. Do not apply this to your country. Follow the laws of your country, follow the advice of the doctors, or follow the advice of public health in your country, because your coronavirus outbreak might be at a different, might be of different intensity, or might have some different factors that need to be taken into consideration. What I'm again pointing out is WHO, World Health Organization, has not closed down the mosques. Neither have they said that basically, the public access to the mosques need to be completely shut down. They have given recommendations. Link is in the description. Please go ahead and read it. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.